According to the latest statistics in South Africa, 6.4 million people in the country are HIV infected, out of a total population of 52 million. 1 in 3 pregnant women is HIV positive, and South Africa is still the country most affected by HIV/AIDS. But it also has the biggest antiretroviral program in the world.
At the moment, we account for 30% of the global figure of people who are on ARVs. At 2.4 million, there are 8 million people in the world who are on ARVs, and 2.4 million are in South Africa. And we are intending to increase that number to 4.6 million in the next 24 months.
When I was an intern at Chris Hani Baragwanath Hospital in 2006, I would certify 25 to 30 bodies a night. But in 2012, interns are certifying 5 bodies a night. And we know that the deaths back then were AIDS-related. And so thanks to treatment, things have changed drastically. But I can say that I think after 2009, President Zuma has shown tremendous political will in terms of the program. And that's why we've seen the gain that we have seen.
By all accounts, South Africa has come a long way since the days of so-called AIDS denialism under President Thabo Mbeki's rule from 1999 to 2008, a time when HIV/AIDS experts reported seeing death everywhere across the country. 10 years ago, 400,000 HIV/AIDS patients were on ARV treatment. This has now increased to 2.4 million people. When one talks to HIV/AIDS experts and activists about the rollout of antiretroviral drugs in South Africa today, they'll tell you that the treatment works. As recently as 2009, there was still a long waiting period. Now patients can access ARV treatment within weeks of being tested HIV positive.
I think the best thing that has happened in the last year or two is the fact that we've gone from 3 drugs that were taken once a day to 1 drug that is taken once a day. And that improves adherence. If you're taking 1 tablet a day, it's much easier to remember and much easier to stick with instead of taking a whole bunch of tablets a day.
It has brought huge changes to South Africa, I must say. Firstly, the number of people who used to die of HIV and AIDS is tremendously reduced. Secondly, we have reduced mother-to-child transmission. If you go back to 2004, 70,000 children in South Africa were born HIV positive. But now it's about 8,600 only.
The health minister says many hospices and even funeral homes in South Africa have had to close their doors because of the dramatic drop in AIDS-related deaths.
We have a great program. We have the best drugs available. People should not be dying.
Rene, Carme, CCTV, Johannesburg.